The uterine tubes are also known as oviducts or fallopian tubes. They're paired structures that extend from the fundus of the uterus toward the ovaries. These tubes serve as the conduit through which an ovulated oocyte will travel from the ovary to the uterus. The primary function of the uterine tube is to provide a pathway, but it's also where fertilization might occur. Before I do this slide, I just want to note that the anatomy on my diagram is not correct. I mean, this is what you get for using open source diagrams. But the thickness of the uterine tubes is not really accurate in this diagram. So the uterine tubes are made up of a couple different segments, including the infundibulum, the ampulla, and the isthmus. The infundibulum is this funnel shaped, and I'm going to put an N there. It's this funnel shaped opening near the ovary, and it has these fimbriae that capture the egg after ovulation. Actually, in ovulation, the ovary spits the ovulated ovum and spits it out, and it may not exactly like go into a uterine tube. So these fimbriae, pictured here also as little tiny like fingers, they wave the ovum back into the uterine tube. If sperm are present in the uterine tube during ovulation, fertilization typically happens in the ampulla, which is the largest section or the widest section of the tube, which is not accurately pictured here. This other section here is the isthmus, which is the connection of the uterine tube to the ovary at the fundus of the ovary. After fertilization, a zygote would move through the tube into the uterus for implantation, the same pathway that an unfertilized ovum would pass. The cilia of the uterine tube and the smooth muscle surrounding the uterine tubes, they assist in the movement of the ovocyte or the fertilized egg along this path, because neither of those two structures, oocyte or fertilized egg, have anything like a flagellum. Uterine tubes have a very highly folded epithelial lining composed of simple columnar epithelium. Lots of folds, as you can see there. This epithelium contains both ciliated and non-ciliated cells. The ciliated cells play a big role in moving that ovulated oocyte or fertilized ovum toward fertilized zygote toward the uterus. The folds in the epithelium, they increase surface area, and that provides a really good environment for movement, and it also provides an area where sperm and egg are more likely to encounter each other. Beneath the epithelial layer, the uterine tubes, they consist of two layers of smooth muscle, just like your digestive organs, and they facilitate peristalsis, which were those wave-like or alternating contractions. And peristalsis propels the oocyte or the fertilized zygote along the tube to the uterus. These muscle contractions, in combination with ciliary action, they ensure that the oocyte or the fertilized zygote will move from the ovary through the uterine tube toward the uterus for potential fertilization and implantation. An ectopic pregnancy is a pregnancy that starts to develop here in one of the uterine tubes instead of developing in the uterus after implantation. As I just mentioned, an ectopic pregnancy can occur when a fertilized egg, like this one that you can see here, when it implants itself and it begins to develop outside of the uterus. This can happen if there are issues with the uterine tubes, such as blockage or damage from HPV, and this could prevent the zygote from reaching the uterus and implanting. As the embryo grows, it can cause the tube to rupture, and this can lead to internal bleeding, severe pain, and obviously life-threatening complications for both mom and baby. Ectopic pregnancies cannot be carried to term. And treatment typically involves medication or surgery to remove the embryo and repair damage. Tubal ligation is a surgical procedure in which a fallopian tube or tubes are permanently blocked, sealed, to prevent eggs from traveling from the ovaries to the uterus. This procedure is commonly performed as a form of permanent contraception. Tubal ligation can be done through a lot of different methods, including cutting, tying, using clips, using rings, anything to block the uterine tubes. While it's highly effective at preventing pregnancy, it is considered permanent, and reversal is often complicated, so it's typically chosen by women who do not wish to have children in the future, and is also typically chosen after counseling to make those decisions.